Our province has entered a critical stage of the COVID-19 pandemic. Like most places around the world hit by the third wave, it's been with us for a while now, but it has reached new heights in Alberta recently. We have set case records, but what's more concerning, we've also set a record for the number of Albertans with COVID-19 in intensive care. We have always sought as a province to protect both lives and livelihoods throughout the pandemic. This has meant resisting pressure to implement widespread and long-term lockdown policies because we recognize the severe impact on people's lives, and that's why we've taken a balanced approach, following the evidence and applying targeted restrictions. Restrictions that have been designed to limit viral spread. From day one, our goals have been to avoid large-scale loss of life, to keep our hospitals from being overwhelmed, while minimizing the damage of restrictions on our broader society. Governments must not impair people's rights or their livelihoods unless it is absolutely necessary to save lives, and in this case, to prevent disaster from unfolding in our hospitals. Unfortunately, that is the situation that we are facing today. The arrival of highly transmissible COVID variants in Alberta is putting real pressure on our healthcare system. Despite 64% of Albertans over the age of 50 having received at least one dose of a vaccine, the disease continues to spread at an alarming rate, especially amongst younger people. Now, let me walk you through the numbers. Today, we have 671 people in hospital with COVID-19, 150 of whom are in intensive care. But of course, we also have to treat non-COVID patients, meaning that there are a total of 226 Albertans in ICU right now. That's far more than the total number of ICU beds that we would have in a typical year available in our healthcare system. Alberta Health Services has worked hard to develop surge capacity, so if pressed, we can open as many as 425 ICU beds. But, and this is a big but, that would require mass cancellations of surgeries and other care that people are counting on. Now, if exponential growth of COVID-19 in Alberta continues, it would begin to push the outer limits of even our surged and expanded hospital capacity within weeks. So let me be clear. We will not permit our healthcare system to be overwhelmed. We must not, and we will not force our doctors and nurses to decide who gets care and who doesn't. And that is why we must act now to stop the spike. Earlier today, the Emergency Management Committee of Cabinet approved a set of new public health measures to stop the spike of COVID-19 in our province. These stepped-up measures will take effect province-wide, with the exception of a few communities that have very low levels of spread. Let me begin with the most difficult decision. Starting this Friday, May the 6th, kindergarten to grade 12 will move to at-home learning until Tuesday, May the 25th, after the long weekend. I know this is a real disruption for both kids and parents, but with the current level of community spread, we have 80,000 students and staff who are in self-isolation and will soon reach a point where many schools will not be able to operate. This two-week reset will allow schools to come back for in-classroom instruction right through to the end of the academic year. The following measures will take effect immediately and will be in place for at least 3 weeks. Workplaces with COVID-19 outbreaks will be mandated to close operations for 10 days, with exemptions for critical workplaces. All post-secondary institutions will move online. Retail services must limit consumer capacity to 10% of fire code capacity or a minimum of 5 customers. This includes both individual stores and common areas. Outdoor social gatherings, currently limited to 10 people, will now be limited to 5, with a strong recommendation that people limit such gatherings to no more than 2 family cohorts. Places of worship, currently limited to 15% capacity, will be limited to 15 people, as they were last spring. Sadly, funerals, currently limited to 20 people, will now be limited to 10. Effective at 11:59 p.m. on this coming Sunday, May the 9th, personal and wellness services, including hair salons, tattoo parlors, tanning salons, and nail salons, will close for the next 3 weeks. In-person dining at bars and restaurants, including outdoor patios, will have to close during the same period. They may be open for takeout only, and delivery, of course. Outdoor sports and recreation will be limited to households and close contacts only. And youth and adult performance will close. Health, social, and professional services like massage therapy, physicians and dentists, accountants, and lawyers will remain available, but by appointment only. And indoor fitness remains closed. We are doubling the basic fine for violating public health measures from $1,000 to $2,000. The maximum fine for serious offenses remains under the law $100,000. And we are introducing a tougher enforcement protocol for repeat offenders, because we will not tolerate those who endanger the health of their fellow Albertans while the vast majority of people are doing the right thing. Now, those who can work from home must do so, and masks are required at all indoor work sites unless workers are distanced from others. A full list of these measures is available right now at alberta.ca-stop the spike. But there's one simple message. If you can stay home, please stay home, at least over the next 3 weeks. I know all of this is discouraging to hear. Nobody wants to be here, especially after 14 months with multiple waves of this pandemic. But our commitment to the health and safety of Albertans must come first. The good news is that we have vaccines on our side. They're already working wonders, and they are finally arriving in larger and larger numbers. We'll be able to vaccinate all Albertans over 16 years of age very soon. The vaccines will catch up to the virus and defeat it, and we'll do so this spring, this summer. We have seen it happen elsewhere. It's only a matter of time before it happens here in Alberta. But until then, we have to protect our hospitals. If we don't want widespread delays or cancellations of surgeries and other health care, we have to stop the spike right now. If we want to guarantee a staffed hospital bed for every Albertan that may need one, for any reason, COVID-19 or otherwise, then we have to stop the spike right now. So please follow the health guidelines in your area, particularly if you live in one of the hotspots. Get vaccinated when it's your turn. If you're eligible to be vaccinated now, please don't wait a day longer. Summer is just around the corner. And that summer, what it will look like depends on what all of us do. So let's come together and show that we are Alberta strong, so that we can move past this terrible time to a bright Alberta summer. Thank you and good night.